we will talk about enlarged lymph nodes. What are lymph nodes? They are small bean-shaped, elongated organs, and their main function is to filter lymph from bacteria, microbes, viruses, from cell debris, and from harmful substances. So, main function of lymph nodes are filtration, and they usually are concentrated in three places, like neck, in armpits, and groin. So in these three places are concentrated, but lymph nodes are almost everywhere. They are more than 500 in our body. So what they are doing, they catch these bacteria and viruses and or cell debris, and they neutralize. How they neutralize? Because in the lymph nodes, we have lots of white blood cells, different types of white blood cells, and these white blood cells or leukocytes neutralizing these bacteria, viruses, or toxins or cell debris. So lymph nodes cleans our lymph. That's how lymph nodes looks like under its preparation for microscope. And when there is some important activation in our body, like infection or inflammation or autoimmune activation of immune system cells, or grow, for example, cancer, it can cause enlargement of lymph nodes. And we will talk about what are the 5 most common causes of enlarged lymph nodes. First and most important cause and most common cause is viral infection. Why it's most important? Because it's responsible on most cases of enlarged lymph nodes. More than 50% of cases, almost 60% of cases of enlarged lymph nodes are because of viral infection. Which viral infection causes most commonly enlarged lymph nodes? Common cold viruses. Common cold, which is very common viral infection, causes enlargement of lymph nodes in the neck usually, and these enlarged lymph nodes are painful, and person has runny nose, sore throat, cough, mild fever. And when person has common cold, then it's high likelihood that if this person has enlarged lymph nodes, it's because of common cold. It's a very common scenario. And this enlargement of lymph nodes occurs after 2 days when after symptom starts. So, and these enlarged lymph nodes can stay enlarged for several weeks. Other viruses also cause these enlarged lymph nodes, such as influenza virus, COVID-19, Epstein-Barr virus, which causes infectious mononucleosis, and HIV also can cause enlarged lymph nodes. And second most common cause of enlarged lymph nodes are bacterial infections. Bacterial infections are responsible around 15% of cases. And what is the most common bacterial infection which causes enlarged lymph nodes? It's streptococcal infection, it's tonsillitis, tonsil infection, which causes enlarged tonsils. You can see here it causes sore throat, it causes fever, and person's immune system is weakened, and person gets common cold easily, person gets sore throat easily. It's streptococcal infection, especially in children. It's very common scenario, and it causes enlarged lymph nodes. Also, more serious diseases causes enlarged lymph nodes, such as tuberculosis, for example, and tuberculosis causes chronic cough, night sweats, low-grade fever, which lasts for several months, and coughing up blood, also symptom of tuberculosis, and unintentional weight loss. Person feels weak, person loses weight, and person looks like pale. Its appearance is pale. And other bacterial infection also causes enlarged lymph nodes, such as cat scratch disease. Cat scratch disease is because of cat scratch or because of cat bite, and around the area where there is cat scratch or cat bitten, around this area lymph nodes can be painful and enlarged. So Viral infection is first, which causes enlarged lymph nodes. Second most common cause is bacterial infections such as streptococcal infection or tuberculosis or cat scratch disease. And third most common cause of enlarged lymph nodes is autoimmune disease. Autoimmune disease is also very important because they cause enlarged lymph nodes for a prolonged period of time and they are not painful. When we're talking about infections like viral and bacterial infections, usually lymph nodes are painful, but when we're talking about autoimmune disease, lymph nodes are not painful. And most common disease which causes enlarged lymph nodes from autoimmune disease is rheumatoid arthritis. What is rheumatoid arthritis? It is when our body, when our immune system mistakenly attacks our joints. It causes rheumatoid arthritis, and in this case person can have enlarged lymph nodes also, and it's painless. And another disease is systemic lupus erythematosus. Systemic lupus, in this case, our immune system attacks our skin and causes inflammation of skin, and butterfly rash on the skin is characteristic of systemic lupus erythematosus, and sometimes it affects also internal organs, including joints, including other internal organs, and including lymph nodes, and lymph nodes are enlarged. And Sjogren's syndrome also is autoimmune disease, and in this case we can have enlarged lymph nodes. What is Sjogren's syndrome? During Sjogren's syndrome, immune system mistakenly attacks body's own glands, like mucous glands, for example in the mouth, and person has dry mouth, dry skin, dry eyes, dry vagina, dry nose. So person has total dryness. When there is Sjogren's syndrome, person has dryness everywhere, dry skin, dry eyes, dry nose, dry mouth, dry vagina. It's Sjogren's syndrome, and Sjogren's syndrome also attacks lymph nodes and increases lymph node size. And fourth most common cause of enlarged lymph node is cancer. Cancer causes enlarged lymph nodes around in 5% of cases. And most common cancers which causes enlarged lymph nodes are lymphoma and leukemia. Lymphoma and leukemia. On the picture you see it's lymphoma. It's not lymph node anymore. It's already cancer. It's cancer. So cancer causes enlarged lymph nodes. And metastasis also causes enlarged lymph nodes because they are stuck in the lymph node and they start growing, and that's why metastasis also causes enlarged lymph nodes. Metastasis from lung cancer, breast cancer, thyroid cancer, melanoma, and from other cancers. So when cancer grow, it causes also enlarged lymph nodes because of spreading metastasis. That's huge problem in medicine also. And when there is lymphoma, what are the symptoms of lymphoma? There is enlargement of neck, armpit, and groin lymph nodes, and usually they are painless. Sometimes they become painful after alcohol intake. Person can have unexplained weight loss, fever, night sweats, fatigue, and itching, and diagnosis is made by biopsy when these enlarged lymph nodes are biopsied and samples are taken and seen under the microscope. That's the idea of biopsy. And when you touch lymph nodes which are enlarged because of cancer, they are firm to touch and immovable. They are not moved, and they are painless. If there is painful lymph nodes, in most cases they are because of infection. They are not because of cancer. So if lymph nodes are painful, it's not cancer in most cases. And leukemia is also cancer which causes enlarged lymph nodes. It causes widespread enlarged lymph nodes, and in this case we have fatigue, fever, frequent infections, easy bleeding, easy bruising, weight loss, bone and joint pain, and enlargement of spleen and liver. And we have also significant changes in blood tests, and blood test should be seen with differentials. It's very important. And there is significant changes in white blood cells, red blood cells, and platelets in many cases when there is leukemia. So leukemia and lymphoma and metastasis can enlarge lymph nodes. And what are steps, or what we do when a person has enlarged lymph nodes? We think about infections first. It's very fast. If they are painful, especially, we do complete blood tests with differentials. It's very important. Erythrocyte sedimentation rate is important because it's inflammation marker, and C-reactive protein is important because it's also inflammation marker, and it can be elevated during infections and autoimmune disease also. And ultrasound of the lymph nodes are very important. During ultrasound, if there is normal and slightly increased lymph nodes, usually it's not because of cancer. When there is cancer, usually lymph nodes are round shape. So normally it should be elongated, but in case of cancers it's round shape. And when their architecture also is changed, when there is short to long axis ratio is more than 0.5, then it's worth to pay attention of such lymph nodes, because it looks like more round, and it can be cancer or can be metastasis. So also, if there is hypoechogenic or darker hypoechogenic in ultrasound or darker lymph nodes, you should pay attention to them also. If there is no fatty hilum, fatty outer coating of the lymph node, which should be visible in normal cases, and if there is no this fatty hilus, then it can be also sign of metastasis. And if in Doppler ultrasound, when you check blood flow in the lymph nodes, if there is active blood vessels and there is increased blood flow, it can be also sign of metastasis. That's all I wanted to say. So when we see enlarged lymph nodes, first we think about viral infection, second we think about bacterial infections and autoimmune disorder, then about cancer. And context matters, of course. Context is important, of course. And if there is suspicious lymph nodes, we do biopsy. It's very important. Thank you for your interest. Thank you for your watching. If you like my videos, please thumbs up. If you like my channel, please subscribe. Thank you very much. Bye for now.